Virtual consultation versus real consultation. Don't do it. You need a real consultation. Let's look at a consultation, what it is. A consultation is basically where you get to meet the doctor. If it's a real consultation in person, you get to tell him your problem, you get to tell him your goals, your desire, and discuss your outcome of the surgery. The surgeons get to look at you, examine you, see what the issue is, and there's nothing ever better than the real thing. A virtual consultation is a substitution for a real consultation. But one thing that can be said, there's a place for virtual consultation. It's a nice place to start a consultation where you get to voice your problem, your desires, what you would like to get addressed. To get to hopefully it's done over some kind of visual link where he gets to see. Okay, but there's one thing that's still lacking. Surgery is really a science, but it is an art. It's about thinking, it's about feeling, it's about touching, it's about getting all your five senses information. And those are things that you get from a physical consultation. So you're lacking information when you don't get a physical consultation. Let's say you want to get liposuction, for argument's sake. Okay, we see the body, we examine the body, but there's nothing better than when you're able to do what we refer to as a pinch test. See how much fat is there. Try to determine the quality of that fat. Is it a soft, is it a firm fat, is it fibrous? You get information that you will never get through a virtual consultation. I know, for instance, when somebody has a what I refer to as soft texture, or even firm versus fibrous fat. If someone has a soft or maybe slightly firm fat, I know I can get out a lot of that fat. Fibrous tissue, it is not fat, it is fibrous tissue, so you won't get it out. Let's look at the skin. We need to see what the skin quality is. Is there stretch marks? Is there excess skin? Is the skin thick? Is it thin? Does it have elasticity to it? And those are things that you get from a physical consultation. So you're lacking information when you don't get a physical consultation. As I said, you should always get a real consultation. Let's say you get a virtual consultation, and I mentioned you should not proceed right on to surgery with just a virtual consultation. You get a virtual consultation, as I said, it's a meet and greet in a way. You will get a real consultation at least a day before your surgery. So therefore, you start with a virtual consultation, you get a real consultation, you get to correspond back and forth. The doctor get to examine and see what the issues or problem, where you can determine what is possible, what matches with your goals and desire. You get to walk away. You get to think about it. You get to come back the following day for your surgery, and if you have a question, they can also be answered. Okay? As I usually say, an explanation before surgery is an explanation. An explanation after surgery may sound very much like an excuse, and you don't want to have that. You want to be, upfront with all the information, so you can make an intelligent decision. So, whenever possible, always opt for a real consultation, in-person consultation. And if you have to opt for a virtual consultation, it is just the first step in a process that will put you on to a real consultation before your surgery. Okay? With that being said, thanks guys. Appreciate it.